Lascan Corla, I spoke on the 14th of May last in terms of contact tracing, and what I said at the time is that we have a HSE that was playing with figures. I said that the system wasn't working and that members of Dáil Éireann were being fed organic fertiliser, was the phrase I used at the time, manure, in terms of what was going on in terms of contact tracing. I went on to say that the government cannot ask people to continue to make such efforts if the truth about the consistent delays in contact tracing and informing people of their results are being hidden from them. And that we cannot allow, under any circumstances, a second wave of infection. Now, I had no great premonition in relation to what was going to happen, but I was looking at the facts as they were being presented to me. And I have to say that I was absolutely speechless when I heard that the HSE now has abandoned its contact tracing system and has told people via text message to do their own contact tracing. So we're asking older people to click on the links that they receive on a text message, to download information from a website and to make contact with their close contacts. We're asking people whose mother tongue is not English to do the same thing. And we're asking young people who, by their nature, are going to have to significantly restrict what they can do if they go and actually tell their contacts that they have been confirmed positive for COVID-19. It is absolutely ludicrous in relation to those three categories, and yet we had the Minister for Health come in here to the House earlier and tell us that he was defending the decision in relation to that. But this should not come as a surprise to anyone. Over the last month, I have raised an issue with the Taoiseach, the Minister for Health, the Chief Executive of the HSE, the Minister for Education, the Minister for Children and the Minister for Defence, a third of the Cabinet. And that is the scandal whereby existing frontline therapy staff, occupational therapists, physiotherapists and speech therapists were involved in contact tracing for the last 7 months instead of actually the interface with young people who desperately need those services. And I would ask you, Aristot, when you're responding, that you would address that specific issue because it affects your constituents and my constituents, the 1,000 children across Roscommon and Galway. But surely that should have sent off warning bells across Cabinet if we had a situation where these therapists were doing contact tracing because there was obviously something fundamentally wrong. I put a very simple proposal to government, and that was that Defence Force personnel or retired Defence Force personnel would actually take over the role of contact tracing. We have 623 former members of the Defence Forces who looked to re-enlist to help out during the pandemic, who haven't been taken on board by the Defence Forces for various reasons. But they are ideally suited to be carrying out contact tracing. Not one of them was contacted. Deputy Cathal Berry and myself brought an amendment forward here on the 26th of March to ensure that the reserve members of the Defence Force could be used to support the efforts in relation to contact tracing. They have not been used to do that. Yesterday, I got a phone call from a very senior health professional in this country who had been stopped at a Garda checkpoint and asked where he was going, and he was travelling to work. There were 14 members of An Garda Síochána on that particular checkpoint. Now, he made the point to me that will have absolutely no impact on the spread of this particular virus. But the skills that the members of An Garda Síochána have would be very useful to deal with the backlog that is there in relation to contact tracing. And it would have been far more use that they had spent their shift doing the contact tracing of those older people, of those young people, and those people whose mother tongue is not English, rather than standing on the side of the road asking people where they were going. And when we're on the issue of history, and I'd ask the Irish Thought to come back to me as well in relation to this. Last June, I wrote to the Minister for Health, the Chief Executive of the HSE, the Secretary General of the Department of Health, pointing out to him the desperate situation that we had in Portiuncula Hospital in Ballinasloe, where 10% of the beds were lost because of COVID-19. And the hospital was very proactive. It put forward two very specific proposals, looking for 2 modular buildings, one for an accident emergency department so they could segregate COVID and non-COVID patients, and a second modular unit so that they could take the outpatient department out of the main hospital itself and separate it from the hospital, which makes logical sense, and convert the old outpatient department into single isolated beds to replace the capacity that was lost by COVID-19. We still have no indication as to when those facilities will be put in place as we now head into the second wave of and we are having to try and manage a situation in the busiest hospital across the Midlands that has 10% less capacity than it had this time last year, and had many hundreds of patients on hospital trolleys throughout last winter. And I hope, Minister, you can respond to that issue. And while we're on the issue of our own patch, Minister, on Wednesday here in the House, the Taoiseach, speaking about nursing homes, told us that we had learned from the first phase of the pandemic. We learned very little when we see what went on in my constituency yesterday. In a nursing home that I know well, in fact my own late grandmother was a resident in the same nursing home. A nursing home that has provided an exceptional level of care in that community. Now, I pointed out to the Taoiseach here yesterday in the House that, yes, I wanted the issue addressed in relation to that nursing home, but I didn't want to see that being repeated in any other nursing home in the country, regardless of where it was, and that there needed to be a panel put in place that could actually go in and deal with the situation instantly when a problem arose. And speaking later, I suggested that we should have a crack squad within our defence forces of medical professionals, of cooks and cleaners that could, in such circumstances, step in immediately. Because the difficulty in relation to this particular nursing home was that 90% of the staff were told on Tuesday evening that they had to isolate for the next 14 days, and we had 3 staff left to run that nursing home the following morning. Now, we needed immediate staff. Absolutely, there was always going to be a challenge in terms of getting agency staff at such short notice. Naturally enough, people weren't going to be rushing in to a situation like that. But in this instance, within 30 minutes of that particular nursing home, there are over 800 permanent Defence Force personnel who would be quite willing to go in and provide that service on a short-term basis until the other medical staffing was put in place. Subsequent to that, I was informed by a senior health official and a member of the government that there is such a plan, that there is a plan in place, and that there is a cohort of Defence Force personnel that can do that. But the Defence Forces have not been asked to establish that crack squad that could actually go into those nursing homes. The Defence Forces hadn't been asked to do the contact tracing as I had been requested. And the Reserve Defence Forces have not been called up. And I have to ask, why is that the case? And the only conclusion that I can come to is that we have staff, senior staff within our health sector who are involved in a face-saving exercise. We need to remember that the Department of Health in this country has a bigger budget than NASA in the United States. And NASA can put a man on the moon, and we can't put 2 nursing staff into a nursing home in the west of Ireland. We can't put a system in place that we can actually contact people who are positive for COVID-19, find out who their contacts are, and make contact with them. So this state-of-the-art app that we launched with a huge fanfare is redundant, because unless the phone call is made to the individual and the PIN code is given from the contact tracing team, that app is of no use. So we spent hundreds of thousands of euro. We spent a huge marketing budget. All of us, I think, here and a huge portion of the population downloaded the app. And now it's worthless because we can't get the phone call to get the PIN code to release those particular numbers. And the frustrating thing about it is the most basic requirement of a public health official in this country, their very basic requirement of any public health official in this country is to be able to do contact tracing. It is the bread and butter. Vaccinations and all of that is supplemental to that. But that is the one thing that they're all trained to do. And our public health management and officials can't do that one thing 7 months after the initial surge. And it is totally unacceptable that that's the case. Just finally, Minister, I have in my possession an email from a nurse who was so frustrated in terms of the reports on the media last night regarding our local nursing home. She is registered with Ireland On Call, has worked in nursing homes over the last number of months during the pandemic, and has not been called to do this work. So clearly the staff are there, but we're not connecting up the dots. Thank you.